I'm Dr. Tarek Ali, a professor of internal medicine and metabolic and endocrine disease, a medical expert and a medical lawyer, and also researcher in the philosophy of science and philosophy of medicine. I'm going to present an important topic in this fantastic conference, in our conference in Berlin, Germany, in the coming July 2020. But I like to give a small note about one of the most important fields. Many topics will cover in this field, which is the field of diabetes mellitus. Of course, diabetes is a very common chronic medical disorder which affects the millions of people in the world, and the diabetic syndrome is heterogeneous. And I want first to say that the diabetes in which we are going to talk about is the diabetes mellitus, to be differentiated from diabetes insipidus, which is another type of diabetes. And by the way, diabetes means too much urine or excessive urine. The diabetes mellitus, which is one of our conference important field or topic fields, is the one which we are going to discuss in the conference. And the diabetic syndrome is a very heterogeneous clinical disease, and it is a group of chronic metabolic medical disorders. The denominator of it is hyperglycemia, and the most important type of the diabetic syndrome is type 2 diabetes, which affects about 90 to 95% of the diabetic populations. But there are also other types of diabetes, like the type 1 diabetes, which is common in childhood, and also the gestational diabetes, and the other rarer types of diabetes, like the MODY or the MODY syndromes, which is an inherited type of diabetes affecting the adolescents and young adults. And also we have the rare diabetic disease associated with genetic syndromes, which is a rare category. And we have also what we call the secondary or endocrine diabetes due to elevation of insulin antagonists. By definition, the diabetes mellitus is due to problems related to insulin secretion, insulin action, or both. Whether this is due to genetic factors or due to environmental or developmental factors, it is a constellation of many factors which help in the initiation and the augmentation of the occurrence of diabetes mellitus. The environmental factors very important, the genetic factors very important, but I want to focus on the issue of the environmental or the acquired factors in the etiopathogenesis or in the pathobiology of diabetes mellitus, which is related to the abnormal lifestyle of people, which predisposes them to or precipitates the occurrence of the disease in many of these patients. And this is, to be more accurate, the obesity and the chronic stress. Obesity plays an important role in the etiopathogenesis of diabetes, because obesity is the most common cause of insulin resistance, which is the main pathobiologic factor or pathobiologic phenomenon in the pathology of type 2 diabetes, which is insulin resistance. Obesity is increasing, and there is a pandemic of obesity in many countries of the world, in the whole world, and this is the main cause or one of the main predisposing factors to the diabetes mellitus. Obesity is very important. We have to address it, and also the chronic stress. Regarding the management of diabetes, we have to focus on the treatments or the future treatments which address the hyperglycemia, which is the main denominator of this chronic metabolic disease, and also address the complications of diabetes and address the underlying pathophysiologic defects, which we call it the ominous octet in the pathogenesis of diabetes syndrome. Any medications should consider, and also we should target the complications, especially the cardiovascular complications and renal complications and problems in the eyes and nervous system and the peripheral vascular disease. So we should focus on medications which help in improving also not only the hyperglycemia but also the prevent or minimize the frequency and severity of complications. We will also discuss in the topics related to the diabetes about the future prospects of precision medicine and the what we call the evaluation of biomarkers and the genetic risk scoring in diabetic patients, which will improve the management of diabetes mellitus in general. Let us see you in Berlin, in Germany, in July 2020 to address all of these topics. Thank you so much, and see you then.